Before starting the procedure, wear mask and gloves and check your surrounding. You need to make sure the area is safe. Then call for the emergency services and inform.
Check the surrounding. If the place is safe, then check the patient's condition. Hello, can you hear me?
Yes, doctor.
Okay. So patient is responding, but he is confused. We should check the patient's airway. Since the patient is responding, the airway is normal. So we should check the patient's breathing by observing his chest movements. So on this patient, we can see that he has a respiratory rate of 24 breaths per minute. After that, we should check the patient's circulation by palpating the carotid artery. The patient pulse is 110 beats per minute. So the pulse is beat. Now we should check the patient's skin if the patient have any wound or bleeding in his body. So the patient have
No wound in right hand.
right hand and in the chest. We should immediately do first aid by dressing the wound and applying bandage with some gauze beverages.
Occlusive dressing should be done to secure to the body with the tape on 3 sides, leaving the 4th side open to allow trap air to escape the chest cavity. And we prepare the first aid to cover the wound with an occlusive dressing that designed to be airtight. The patient condition is unstable.
I'm going to check his neurological examination. So, is it okay for you? Okay. So, can you open your eyes? Okay. So, there is eye opening to the pain stimuli and he is responding to verbal command. Now, I'm going to check the motor response. So, can you raise your arm little bit? Okay. So the patient responding to the motor response. Now I'm going to check your eyes. So the left pupil is larger. Now I'm going to perform head to toe examination. Is it okay for you? Okay. So firstly, we should inspect and palpate the head and chin behind the ears and every part of the head. After inspection and palpation, there is a bruising in the mastoid process. Now I am going to palpate and inspect your neck. So the neck is normal and there is no bruises. Now I will palpate and percuss the chest. There is signs of trauma. Now I am percuss the chest. The percussion is also normal. Now I am palpate and percuss the abdomen. There is sign of traumas. Now I am percuss the abdomen.
There is signs of bruising. Suspect internal bleeding could be.
I'm going to palpate and palpate the pelvic area. There is no signs of trauma. On inspection of upper extremities, there is no sign of bruises and bleeding. And in the lower extremities, there is no sign of bruises and bleeding.
As the paramedic arrive, the patient will be given with the neck corner for neck stabilization. He will be transferred on stretcher. He will be needed the infusion therapy, giving during 20 minutes about 1,500 to 2,000 ml of normal saline solution during the journey to the hospital. This is to stabilize his vital sign, to replenish the electrolyte loss as the patient is expected to have internal bleeding. The IV access will be needed. The intubation of trachea will not be needed as the patient can breathe on his own. The cold application to reduce swelling and bleeding has been applied. He also will be given analgesic through intravenously. He will be transferred to emergency trauma center. The situation considered as emergency. The wound management also has been done as he being applied with one side free occlusive dressing on his right chest.
For the primary diagnosis, patient have closed fracture in the skull and pneumohemothorax and hemoperitoneum. Patient have a chance of intracranial bleeding, which may have resulted in a hematoma left or right side.
And internal bleeding 20 to 30%.
Hi, so our patient named Ali. So to confirm that you are the one of his relative, is that true?
Yes, I am.
Okay, so I'm going to ask you a few questions, and there's some questions that you need to answer yes or no. Is that okay?
Okay, sure.
Okay, thank you. So may I know how old is he?
He's 25 years old.
25 years old. Okay. What is his occupation?
Ali is a factory worker.
Okay. May I know where did he live?
He lives in Ulitsa, Perkaskava.
Okay. So I'm going to ask you about his past health history. So is he experienced any gastric ulcer?
No.
No. Any allergy? Did he do any blood transfusion before?
No.
Okay. Is he smoke?
No, he doesn't smoke.
Okay. Did he consume any alcohol and drug abuse?
No.
Okay. Did his family has any health history?
No.
Okay, thank you. Did he has diabetes mellitus?
No.
Did he ever do any operations before?
No, he never.
Did he have tuberculosis? Stroke?
No.
Okay. Myocardial infarction? Did he has hypertension?
No, he doesn't have hypertension.
Did he consume any medicines?
No, as far as I know, he doesn't
No.
consume any.
Okay. Okay, that's all. Thank you so much. Do you have any question?
No, I don't have any question.
Okay.
From the subjective examination collected from the relative, we can conclude that the patient has no past health history which may be affected when giving the treatment to him later.
Hi, today I'll be doing the objective examination for the patient. Thanks to the paramedical team for doing the first aid. Now I will begin with general inspection. The patient looks dehydrated and pale. The patient is also partially conscious. The patient verbally is not clear and has difficulty in opening eyes. Now I will be doing the general inspection on the respiratory system. Upon inspection, we can see that there is low unequal expansion on the right side. Chest wall looks abnormal with the wound in the mid-clavicular line of the fourth intercostal space. Upon palpation, we see that the patient has pain in the wound area and there is air leaking through the wound. Upon percussion, we heard that there is dull sound on the lower part of the right side, maybe due to the internal bleeding. Upper part of the right side, we heard that there is hyperresonance, maybe due to the presence of air in the pleural cavity. Upon auscultation, in the right side, there was no sound. In the left side, it was normal, and the patient has respiration rate of 26. So in conclusion, we can see that the patient has tachypnea, cyanosis, dull hyperresonance in the right side of the chest, and this could indicate that the patient may have pneumothorax on the right side. Now I'll be doing the general inspection for the cardiovascular system. Upon inspection, there was no defect at the heart region. Upon percussion, the dull sound was normal. Upon auscultation, we heard that the patient has muffled heart sound. The patient's pulse was 120 per minute. The patient has tachycardia. The blood pressure of the patient was 90/50, which indicates that the patient has hypertension. In conclusion, we can see that the patient has tachycardia and hypertension. This might be due to the hypovolemic shock. The patient needs infusion therapy to meet his vital signs. Now I'll be doing general inspection on the GIT system. Upon inspection, we see that the patient has dry thumb, screen bruise and scratches on the right hypochondrial region. There is no signs of hernias. I did light superficial palpation since the patient is in pain. Upon percussion, the liver size was not found. Upon auscultation, there was no any sound of peristalsis. In the digital rectal examination, the result was normal. In conclusion, we found that the patient has hemoperitoneum. In the primary diagnosis, we see that the patient has closed fracture of the skull base, intracranial hematoma, penetrating right side chest wound, rib fracture, right lung, atelectasis due to pneumothorax, hemoperitoneum. We need to do further lab tests such as CBC test, urine test, chest x-ray, ultrasound of the abdominal wall, ECG, to conclude the patient's condition. On the lab results, we see that the patient has low RBC and WBC count, and on the chest x-ray we can see that the patient has fracture on the fourth rib of the right side, and we also see that there is presence of blood. The ultrasound scan of the abdomen, we can see that the patient has hemoperitoneum.
The family of the patient, right, sir? So after all the tests that we have done to the patient, we have come to this final diagnosis, which is the patient has closed fracture of the skull base, and he also have intracranial hematoma on the right side. He also have penetrating right side chest wound, rib fracture, right lung atelectasis due to pneumohemothorax, and then he also have blunt abdominal trauma and liver damage with hemoperic. And the complication of this, he will have internal bleeding, hemothorax, and also 30% blood loss. So the patient has to be admitted into surgical department, and he will be positioned in supine position, and he won't be having any physical activity, and his diet will be NPO diet, and also he won't be having any exercise, and he will be given medical therapy targeted at symptoms, and also he will be given infusion therapy to meet his vitals, and also he will be given non-steroidal anti-inflammatory drugs for his pain. I would like to tell you about the surgical treatment. He should be going through some surgery, which is surgery on the skull for trepanation to evacuate the intracranial hematoma. He will go through chest draining on the right side, and also abdominal surgery to fix liver. Okay, so before I ask for consent for the surgeries, I would like to explain to you about the different surgeries that the patient will go through. So this surgeries is indicated to the patient, and it is life-saving surgeries. So first we will do skull surgeries, which is to evacuate hematoma, and then we will do chest surgery, which we will do chest draining, and then we will do abdominal surgery, which we will do laparotomy and fix the bleeding. So the patient will be put under general anesthesia, and then for the risk of surgery is quite high, and then the risk for thromboembolic complication and also bleeding complication is high too. And without this surgery, chances to success is doubtful, but with surgery, chances to success is 70%. So sir, do you agree for the patient to go through all these surgeries?
Yes, I want the surgery.
After that, the relative of the patient is given the consent form to fill in and sign.
For surgical operation report, neurosurgery, firstly we prep, drape and surgical access, and then we will do incision at the right temporal area, and we will open the skull with a saw, and then we will evacuate blood and ligate bleeding vessels, and then lastly we will close the wound. Okay, for surgical operation report on chest draining, first we will do prep, drape and surgical access, and then we will do incision at anterior axillary line at 7 intercostal space, and then we will insert a tube with a clamp to evacuate air and blood, and then we will attach the tube to draining system, which is 2 bottle or suction, and then we will fix the tube. For surgical operation report on abdomen, first we will prep, drape, surgical access, and then we will do incision at midline abdomen, and then we will open the cavity. We will find the injured organ and then fix it, and then we will evacuate the blood, clean the cavity and insert abdominal drain, and then we will close the cavity. During intraoperative monitoring at 1 p.m., the patient has pulse of 100, which is increased than the goal, and then the patient also have respiration rate of 22, which is also slightly increased from the goal, and the patient has blood pressure of 100, which is slightly decreased from the goal, and then the consciousness GCS is 14, and then we will continue to monitor the patient. We will re-examine him in 15 minutes. For post-operative day 1, the vital signs of the patient is monitored. Pulse, respiration rate, blood pressure, consciousness and temperature of the patient are in normal range. The drain in the chest and abdomen area is also being monitored. Lab and instrumental diagnosis will be done again to see how well the patient is responding to the surgery. Okay, so for post-operative fluid chart, starting from 2 p.m. and 3 p.m., the patient is given 2,000 ml of normal saline, 1,500 ml of Leteringer, 500 ml of RBCs, and 500 ml of FFP, each for 2 p.m. and 3 p.m. And then starting from 7 p.m. until 2 p.m. the next day, patient is given 100 ml of dextrose 5% water hourly, and then from 8 p.m. until 6 a.m. in the morning, patient is given 200 ml of Leteringer. These fluids are given to the patient because for electrolytes balance and to increase red blood cells after losing during surgery. The lab test result and instrumental diagnosis came out normal, which indicates that the patient is recovering well from the surgery. For post-operative medication, the patient is given ibuprofen intravenously for the pain, to relieve pain for the patient at 2 p.m. And then the patient is also given antibiotic cephalosporin first generation at 2 p.m. And then at 9 p.m., ibuprofen is also given to the patient. For post-operative day 2, the vital signs of the patient are being monitored again. The vital signs of the patient seems to be in normal range. Everything looks normal. The infusion therapy is still given to the patient as the patient is still in MPO diet. So the infusion therapy will give nutritional support and prevent dehydration to the patient.